Cholesterol is a fat that our bodies need for important jobs like making cell membranes, hormones, and helping with digestion. But having too much cholesterol can be bad and raise the risk of heart problems and strokes. It's important to check your cholesterol levels often and make changes to your lifestyle if needed. Today, we're talking about 6 signs that might mean your cholesterol is too high. Number 1. Swollen feet or ankles. Swollen feet or ankles might be a sign of high cholesterol levels. When cholesterol clogs up blood vessels, it can slow down blood flow to the legs and feet, causing fluid to build up and leading to swelling. You might notice this more if you've been standing or sitting for a long time, and it might come with a feeling of heaviness or discomfort. However, swollen feet or ankles could also point to other issues like heart or kidney problems. If you have these symptoms, it's important to see a doctor to figure out what's causing them and get the right treatment. Treatment for swollen feet or ankles depends on what's causing it. If high cholesterol is part of the problem, your doctor might suggest lifestyle changes like eating well and exercising regularly to lower your cholesterol. Sometimes medication might be needed to help lower cholesterol levels and improve circulation. Number 2. Chest pain or angina. Chest pain, known as angina, can be a sign of high cholesterol. It happens when the heart doesn't get enough oxygen-rich blood, feeling like pressure or squeezing in the chest. This pain might spread to the shoulders, arms, neck, jaw, or back. Angina can be set off by physical activity or stress and usually goes away with rest. But it's a serious condition that could lead to a heart attack if not treated. If you feel chest pain or discomfort, it's crucial to get medical help right away. Your doctor might do tests like a coronary angiogram or an electrocardiogram to find out what's causing it. Treatment for angina can involve lifestyle changes, medicine, or even surgery, depending on how bad it is. It's important to work closely with your doctor to manage your symptoms and lower the risk of complications. Number 3. Yellowish bumps around the eyes. Yellowish bumps around the eyes, called xanthelasma, can show up when you have high cholesterol. These bumps happen because cholesterol and other fats build up under the skin. They're mostly found on or around the eyelids, but can appear on other body parts like elbows, knees, and hands too. Having xanthelasma can be worrying for some people because it affects how they look, but it can also mean there's an underlying health problem like high cholesterol or liver disease. If you spot these yellow bumps around your eyes, it's important to see your doctor. They'll figure out what's causing them and suggest the right treatment. This could include lifestyle changes, medicine, or other ways to lower your cholesterol and lower your risk of heart disease and stroke. Number 4. Shortness of breath. Shortness of breath can also happen when you have high cholesterol. This occurs because cholesterol buildup in the arteries can reduce the flow of oxygen-rich blood to the lungs, making it harder to breathe. You might notice this more during physical activity or when lying down. Shortness of breath can be a sign of something serious, like heart disease or lung problems. If you suddenly have trouble breathing, it's crucial to see a doctor right away. Treatment for shortness of breath depends on what's causing it. If high cholesterol is part of the problem, your doctor might recommend lifestyle changes, like eating healthy and exercising regularly to lower your cholesterol. Sometimes, medication might be needed to help lower cholesterol levels and improve breathing. It's important to work closely with your doctor to manage shortness of breath and reduce the risk of complications. In some cases, shortness of breath can signal something life-threatening like a heart attack or pulmonary embolism, so it's essential to seek medical help if you have this symptom. Number 5. Fatigue or weakness. Feeling tired or weak could be a sign of high cholesterol. When cholesterol clogs up arteries, it can limit blood flow to muscles, leading to fatigue or weakness. You might notice this more during physical activity or after sitting still for a while. But tiredness or weakness could also mean other things like anemia or thyroid issues. So, if you feel this way, it's important to see a doctor to figure out what's causing it and get the right treatment. Treatment for fatigue or weakness depends on what's behind it. If high cholesterol is part of the problem, your doctor might suggest lifestyle changes like eating well and exercising regularly to lower your cholesterol. Sometimes medication might be needed to help lower cholesterol levels and improve muscle function. It's worth noting that many people with high cholesterol don't have any symptoms. That's why it's crucial to keep an eye on your cholesterol levels regularly, especially if you have risk factors like a family history of heart disease, being overweight, smoking, or leading a sedentary lifestyle. In conclusion, high cholesterol can be serious even if you don't feel symptoms. So, it's important to monitor your cholesterol levels regularly and make lifestyle changes if needed. Number 6. Numbness or tingling in the hands or feet. Numbness or tingling in the hands or feet can signal high cholesterol levels. When cholesterol clogs up blood vessels, it can reduce blood flow to the hands and feet, causing nerve damage and those strange sensations. You might feel this more in your fingers or toes, but it can happen in your hands or feet too. However, numbness or tingling could also mean other things like diabetes or peripheral neuropathy, which is nerve damage. If you have these symptoms, it's important to see a doctor to find out what's causing them and get the right treatment. Treatment for numbness or tingling depends on what's behind it. If high cholesterol is part of the issue, your doctor might suggest lifestyle changes like eating well and exercising regularly to lower your cholesterol. Sometimes, medication might be needed to help lower cholesterol levels and improve nerve function. If you have any of the symptoms mentioned above or risk factors for high cholesterol, it's important to talk to your doctor about getting your cholesterol levels checked. And that's it for this video. What did you think? Let us know in the comments below. If you found this video helpful or informative, be sure to hit that like button and subscribe to our YouTube channel for future updates. Thank you for watching.